So Jo, you are with the Primary Care Partnership, and is there a role for the Primary Care Partnership in addressing climate change and health?
Yeah, well, I think there's quite a large role. So if I start with just saying that primary care partnerships are generally funded through the Department of Health in the state of Victoria, and there's about 28 around the state, so there's quite a number of us. We'd be the only PCP at the moment who has climate change in our strategic priorities. So it's quite a new area. But if you think about all the agencies that we work with, the health agencies and the bush nursing centres and community houses, they are the ones who have the close relationships with the people in the community who have the biggest impacts from climate change. And those agencies are so incredibly busy just trying to do their everyday work and meet the immediate needs of their community that if suddenly there was a policy that said you also need to do some climate change adaptation or build sustainability in your community, I think there would be very limited capacity to do so. So what the PCP role is and what we've done in our recent program, Rural People Resilient Futures, is we've provided that leadership model. So we've been able to be the leadership platform that is the link with research and state government and work with our agencies to build their capacity so that they understand what their role is, particularly in reducing climate change impacts on their community. Actually, a really lovely example from our last project was we ran some workshops with people from agencies, and a woman from who worked in home and community care in a local government. So she works every day. She sees people living in their own homes, and we all know we want people living in their own homes for as long as possible. And she had never understood that she had any role in climate change impacts and reducing the climate change impacts for the people that she works with. And she came to the workshop, in a 5-hour workshop, and she came up to me in the middle of the workshop and gave me a bit of a hug and said, thanks for inviting me to this. I had no idea what my role was. And then she said, this morning I thought I was coming to a dreaded climate change workshop and I didn't want to come, but now I get it. I get what my role is. So I think that there's a number of people like that working in our community who have that great relationship, but they don't have the capacity. So I think that PCP is that leadership role to build capacity, but I also think we're the conduit between research and the end users as well. I don't think there's a huge disconnect in that way, but I just don't think there's a way in. So I think that that's where the PCP platform can be really well utilised in this space.
So it's a vital role of orchestrating and bringing together and building capacity.
Yes, yeah. That building capacity, and even in the beginning for our project and our community at the moment, it's just building that awareness and identity of the role, and then the capacity, and then that essential link, I guess. Yeah.
So in bringing together a dispersed and a diverse group of agencies and services and other interested individuals, can you speak to the idea of interdisciplinary or multiple disciplinary collaboration?
Yes, yeah. It's really, really interesting because going back in time, I remember going to speak at a conference about one of our projects, and it was a sustainability conference, and I was introduced to somebody from outside the sustainability sector, and I was a little bit taken aback, but I also felt like, oh, well, at least they're welcoming me in and I feel invited. But I think that it needs to be that multi-sectoral approach because, we've talked about the links between climate change and health, and there's the social impacts, environmental impacts, there's very broad impacts and a lot of ways that we can work together. And so I think we need to drop some of those traditional boundaries and work together. Another example, our last project, Rural People Resilient Futures, I know I've talked about that a lot, but it's our last thing that we've done, was funded through the State Government Department of Environment, Land, Water and Planning. And that it was quite new for them, the partnership with the PCP and with the health sector particularly. So that's a new partnership that will move on. We're working together again. We're just about to start working on a project around looking at social networks for disaster resilience, and that's funded through the National Disaster Resilience Grants through Emergency Management Victoria. So, traditionally Emergency Management Victoria would have worked with CFAs and SES, and now they're looking at, well, how else can we work with our community? So there's a real opportunities for joined up approaches and the multidisciplinary approaches. We wouldn't have the woman from the home and community care playing any role if we didn't think about working with the people who work with the community, particularly when we're talking about social impacts. I'm about to go to a meeting at the Department for Energy Efficiency in the state government to talk about what can our role be working with vulnerable people around energy efficiency. So the health sector has such, I think it's because of the link with the community and the link with the well-being outcomes. So, and even so, having beautiful parks and gardens, so keeping the environment beautiful has huge impacts on our health and well-being and our mental health particularly. So there's a lot of opportunity for a multi-sectoral approach. It's how we figure out how to do it together. I think that can be challenging, but once the partnerships are made and people understand their roles, it's really quite easy to do that. Yeah.
So you've mentioned a few home and community care. What other agencies, services or partners have you worked with and do you anticipate working with?
Yeah, so in our partnership at the moment, we work with local government, we work with all the healthcare centres, the community health agencies, the Aboriginal health services. But we've also worked with Sustainability Victoria and Environment Victoria. We have worked with, as I said, the Department of Environment, Land, Water and Planning. Research, so working with Deakin University to, because we're building our capacity as well. This is not anything that we have strong context or the intellectual understanding of. So we need the research partners to guide us along the way. We're doing some work with low-income families around energy efficiency through the federal government Department of Industry. That's also linked us in with the CSIRO with evaluation and Federation University. So there's another sort of link in there. So the partnerships are just growing and growing. And I think if you looked back 10 years ago at the primary care partnership in the health sector, you wouldn't have expected to see those sorts of partnerships develop and work really well. We don't have to know it all. I think that's like us at the PCP, we don't have to know it all. And even in the climate change space, if we went back to when we first began our work, we didn't say climate change. We were a little bit scared to say climate change because we didn't want anybody to ask us about science and we didn't want to disengage anybody. So we just talked about the impacts on people. We didn't really talk about what climate change was, or we didn't talk about projections or anything like that. And in the last project, the Rural People Resilient Futures project, we did. We said the words climate change. We had RMIT University with us and we were working with the Department of Environment, Land, Water and Planning, so they had access to this information. And one of the interesting outcomes of that project, when we asked people what they found most valuable, the second highest thing they found most valuable was understanding what the climate change impacts were on their community. So, so that role and that multi-sectoral approach is terribly important, but I think somewhat easy to do. Yes.
And what was the first thing that people found most valuable?
Well, the first thing they found most valuable was understanding who was vulnerable in their community. We took some time to look at who was vulnerable in our community to climate change impacts, and what we found is that farming families, particularly those who were isolated, were the most vulnerable. People who had cognitive disability, so mental illness or intellectual disability, and people who were isolated and had limited social connection were our three big things that caused vulnerability to climate change.
And Jo, you mentioned before that climate change wasn't a priority and that for a lot of the PCPs it still hasn't been identified as a priority. So why is it that your PCP has picked up on climate change?
I think there's a couple of things. I think there was demand from our agencies at the time when we started to talk about did we have a role to play here. Some of our agencies had been to a conference when there was a plenary session that just mentioned climate change and health, and people came back saying, well, we should do something in this space, but we didn't know what to do, so that it took us a little bit of time. And I've forgotten the question already.
The question...
Oh, and why did we get involved? Yeah,
Why did you prioritise?
so we had this demand from our agencies, and I think we had our executive, we have an executive management committee and an executive officer who was ready to respond to the demands of our community. So the community was saying this, even though we didn't know where we were headed, we took somewhat of a risk and thought, you know, we need to find out a little bit more about what our role is. And the way we actually did that was we got people in the room, and we just, what health professionals tend to do is we had a workshop, and we just thought, well, what are the impacts for our community, and how do we work it all out? So people used frameworks that they knew, in this case being a health promotion Ottawa Charter framework, and that's where people came up with those sort of household energy efficiency and food security and all of those. That's what our role was, and we used a health promotion framework to make sense of it. So we did wait for leadership from government, but we might have been a bit ahead of the time at that point. So we decided that's how we would approach this. So I think that, yeah, we used our internal capacity. We took a bit of a risk, and we responded to the community need. Yeah.
We have been discussing the importance of taking a systems approach, looking at complex issues, you know, that are interconnected. And so when you mention you looked at the Ottawa Charter, would that be an example of a way of understanding systems?
Yeah, well, it works for me. Also, I think that systems thinking is a great way to think of these complex issues, because, you know, we face a lot of complex issues in health, and, you know, around, you know, obesity, for example, and a lot of the individual behaviour change type programs just don't seem to be sustainable or working. So, you know, being able to look at what the system is and seeing, well, where can we interconnect in this system and make some changes, I think is much more sustainable approach and to change, making things better for our community.
And similarly for climate change? Yes, certainly looking at a systems approach. And we did some work with the Victorian Centre for Climate Change Adaptation Research, VICAR, a couple of years ago, and we used a bit of a systems thinking. We used a framework called the Adaptation Navigator, just to start to align our thinking so that we knew, well, where do we want to head in a more strategic way. So our PCP had been doing some work around energy efficiency, more community programs, behaviour change. We'd been doing some work around food security. We've been doing a little bit of work around social connection. But we wanted to be a little bit more strategic about our approach rather than go project on project. So that's when we thought, well, we need to understand who's vulnerable in our community and who works with people who are vulnerable, and then being able to build the capacity of those people to make a change rather than these sort of individual behaviour change. So we've headed down that path of systems approaches, most definitely. Yes. Excellent. So Jo, we've started off by talking about the links between climate change and health, and specifically how they manifest in regional and rural Victoria, the role of the primary care partnership in being able to identify who's most at risk, what the issues are, and in building capacity.
Yes.
And we've talked about your crucial role in interdisciplinary, intersectorial collaborations,
yes,
and having an overlay of a systems thinking approach to these complex problems. Is there anything else that you would like to add to our presentation today?
Can't believe we've discussed so much in such a short time. But the only other thing I think above all that, and it probably intermingles everywhere, is around the advocacy of, you know, for example, being involved in the VICAR, the research project where we started to look at the system. Out of that came a policy advice to state government. So I think that, you know, we need to remember about that not only, I said before, the PCP has this role of building the capacity of our agencies. I think we also have a role of being an advocate to government and to research to direct how that all works as well. So I think that that's a major role of the PCP as well in this space.
And what was the policy?
A policy brief. It was a policy brief, so the policy's not yet developed, but it was around using the PCP platform to work with agencies around reducing the impacts of climate change on their community. Yes.
Excellent. Okay, Jo, I'd like to thank you immensely for your immense knowledge and also for travelling so far, because it's been quite a distance for you to get here today. But we really value the work that you've done and your generosity in sharing it with us. So thanks very much.
Thank you. And you can always look up any of our projects. We have a website, so sggpcp.com, and you'll be able to see our film and lots of other of our reports as well if you're interested in looking further. But no, thank you very much. And this is advocacy as well, so this is a way of sharing it. Thank you.
Hi Jo, welcome to Deakin Uni. Thanks for taking the time to come and speak with us today.
Thanks, great to be here, thank you.
I'll hand it over to you now. So we're really interested in climate change and health and understanding if there are some links and specifically what those links look like for regional Victoria.
Yep, great. Look, thank you. I'll start off first by talking about where I work. So I work for Southern Grampians Glenelg Primary Care Partnership in health and wellbeing. And for those who don't know what a primary care partnership is, we work with agencies and health centres who are interested in the health and wellbeing of the community. So we work in Southern Grampians and Glenelg Shire in southwest Victoria with health agencies, community agencies, local government, all working towards the health and wellbeing of our community. So we're located in Hamilton in southwest Victoria. As for the links between climate change and health, I think our story also started a bit with that story. What are the links with health agencies and climate change? And it actually started in about 2008, where our agencies started to talk about, well, do we have a role to play here in the climate change space? And originally, I think people were grappling with that question. You know, what is the role and what are the links? And it really became clear to us that there were some very close links between extreme weather events and the impacts on the community. And that was, made quite obvious to us, particularly in 2009, post the heat wave there in early February before late January before the Black Saturday bushfires, where I think the coroner in their analysis of fatalities over 5 days of bushfires found that there were 5 days of heat wave, found that there were 374 excess deaths in that time. So we knew that there were strong links then between the extreme weather events, but we still didn't know what the health agency's role might be. So we started to sort of think a little bit more about, what was our role and what we could do in terms of the links. And we began really to think about the everyday impacts of climate change on people, and particularly in a rural setting as well. You remember we have a couple of large townships of about 10 to 12,000 people, then we have smaller townships that can have 200 people, and then lots of farming families. And we thought the impacts were more everyday for people in country Victoria, like household energy efficiency became something quite big, access to food and food security, and not just around growing food locally, but even being able to buy food at the general store, access to water, because in 2008, 2009 we were coming out of a drought, so that was quite obvious. Transport was a big issue, particularly when you live in a rural setting as well. Getting from one place to the other when there's no public transport, like in an urban setting, is quite a challenge. And social connection. And one thing that's been happening in southwest Victoria particularly is there's a changing landscape in people are moving off farm because it's just too hard to farm with impacts particularly of water access. And so they're moving off farm, so their farms are actually getting bigger. So the social connection is changing and our small townships are changing. So that was sort of the start of our journey into looking at the links between climate change and health. And I think that one thing we found along the way is it's really complex. We just completed a project called Rural People Resilient Futures, and you can watch our short film at some point. And that has a case study that shows a story of resilience in a small community called Balmoral in southwest Victoria. And in that community, the petrol station closed down. So this community is about 60, 70 kilometres from any major township. So the impact of no fuel on that town was quite big in terms of people being able to go visit each other when so they wouldn't maybe go to the local football match because they didn't want to use their fuel for that. They were prioritising what to use their fuel for. They might not go to specialist medical appointments because they couldn't get fuel. Or they might shop out of town because they drive to the nearest township to get fuel. While they're there, they'll do their groceries. So even though, we could easily say around sustainability and climate change we should be using less fuel, there's the whole complexity of what that means, in particularly in a rural community. So there's a whole lot of questions to be posed there. That was a long answer to your question, but I think the links are around those everyday impacts and the extreme weather events particularly.
Yes, so that's great, Joey. So you've talked about the everyday lived reality of climate change, of energy, of transport,
yes.
The threats of the extreme weather events and the disasters.
And I think too, in terms of, say, transport, for example, if we think about good links between active transport, what's good for the planet and what's good for the community as well, good for your health, riding your bike to work and walking is great to do, but there are those times where, as I've just explained, it becomes a bit more complex than that.
Yeah, absolutely. Okay, so there are links and there's specific things that impact on regional and rural Victoria and Australia that perhaps are different to the experience of the urban population and communities.
Yes, yeah.
Now, you mentioned right at the start, of course, Jo, that you're from the Primary Care Partnership down in the southwest. And what role is there for your Primary Care Partnership in addressing climate change and health? Yeah,
I think that if we sort of think back a little bit and around the agencies that we work with, so we work with community health centres and bush nursing centres and disability agencies and Aboriginal health, and these agencies have tremendous connection with their community and really can play a major role reducing their vulnerability to the impacts of climate change. But in reality, when you work in these settings, you are so terribly busy just trying to get your core business done and look after the immediate needs of your community that taking on something else that seems quite alien to you, like climate change or sustainability, it just seems unmanageable and unwieldy. So the PCP can play, and in our last project, Rural People Resilient Futures, we did play quite a role in being that leadership platform